Leaky gut is everyone's nightmare. Although abdominal pain and other symptoms are distinctive, it is important not to miss other signals that are not obvious. I explain this in this video. Enjoy watching. Leaky gut syndrome, also known as increased intestinal permeability, is a condition where the lining of the intestines becomes damaged, causing the contents of the intestines to leak into the bloodstream. Normally, the intestinal lining has small pores to absorb digested nutrients while preventing the passage of harmful substances. However, in leaky gut syndrome, this lining can become compromised, allowing harmful substances such as undigested food particles, toxins, and bacteria to seep into the bloodstream. The symptoms and manifestations of leaky gut syndrome can vary from person to person and may encompass a range of health issues. These may include digestive problems, such as abdominal pain, bloating, and gas, allergies, skin issues, such as acne, eczema, fatigue, headaches, muscle and joint pain, concentration difficulties, anxiety, and depression. These symptoms often arise as a result of inflammation and immune system reactions within the body. The exact cause of leaky gut syndrome is not fully understood, but several factors are believed to contribute to its development. These factors may include dietary habits, stress, intestinal infections, antibiotic use, and certain medications. Additionally, genetic predisposition may also play a role in the development of leaky gut syndrome. Diagnosing leaky gut syndrome can often be challenging as it can be associated with a wide range of symptoms. Diagnosis may involve assessing symptoms, taking a medical history, and performing certain laboratory tests. Further investigations such as intestinal endoscopy may sometimes be conducted. Treatment typically involves dietary modifications, probiotics, prebiotics, anti-inflammatory medications, and stress management techniques. Dietary adjustments often include the elimination of potentially harmful foods such as gluten, dairy products, processed foods, and sugars. Probiotics and prebiotics may help to maintain a balanced gut flora and support gut health. Anti-inflammatory medications may help to reduce intestinal inflammation and alleviate symptoms. However, before initiating any treatment plan, it is important to consult with a healthcare professional and undergo a thorough evaluation of your condition. The symptoms of leaky gut syndrome can vary widely among individuals, and an individualized treatment plan may be necessary. What foods to eat? Vegetables, especially leafy greens, such as spinach, kale, lettuce, broccoli, cabbage, asparagus, which are rich in fiber and nutrients. These vegetables are rich in antioxidants, vitamins, and minerals, which can support gut health. Fermented foods, yogurt, kefir, sauerkraut, kimchi, and other fermented foods contain probiotic bacteria, which can help maintain a healthy balance of gut flora. This can improve gut health and support digestive function. Protein sources. Lean sources of protein such as grilled chicken, turkey, fish, eggs are important. These foods are typically light on the digestive system and easy to digest. Gluten-free grains. Gluten-free grains like quinoa, buckwheat, rice can be substituted for wheat, barley, and rye-based grains. Gluten-free grains can be digested without causing damage to the intestinal lining. Healthy fats. Healthy fats such as olive oil, coconut oil, avocado oil can support gut health. These fats have anti-inflammatory properties and may help reduce intestinal inflammation. Fruits. Berries such as blueberries, raspberries, blackberries, which are rich in antioxidants, can support gut health and reduce inflammation. Nuts and seeds. Almonds, walnuts, hazelnuts, flax seeds, chia seeds are rich in healthy fats, fibers, and antioxidants, which can support gut health. Water. Drinking an adequate amount of water can support digestion and regulate bowel movements, which can improve gut health. In addition to foods to include, there are also foods to avoid for individuals with leaky gut syndrome. These typically include gluten-containing grains, processed foods, sugars, artificial additives, and alcohol, which may contain potentially irritating or harmful substances. 7 signs of a leaky gut. 1. Digestive issues. Common digestive problems include bloating, gas, abdominal pain, cramps, diarrhea, or constipation. 1. These symptoms often indicate irregularities in the functioning of the digestive system. 2. Food intolerances. Intolerance or sensitivity to certain foods may develop, especially in relation to foods like gluten, dairy products, soy, leading to digestive issues. 3. Chronic fatigue. Constant fatigue, weakness, or low energy levels are common symptoms. 3. This may be due to inadequate absorption of nutrients by the intestines. 4. Skin problems. Skin issues such as eczema, acne, dryness can be an external manifestation of problems with gut health. 4. Improvements in gut health often lead to improvements in skin conditions. 5. Weakened immune system. Recurrent infections, allergies, or autoimmune diseases may indicate a compromised immune system associated with gut health issues. 6. Brain fog. Symptoms such as lack of focus, memory problems, difficulty concentrating, collectively known as brain fog, may be associated with gut health issues. 7. Joint pain. Rheumatic pains, joint swellings, morning stiffness, and similar symptoms may suggest a relationship between intestinal inflammation and leaky gut syndrome. Don't forget to subscribe and like my channel. If you want other videos and content, please specify in the comment.